Hi, I'm Kimberly Treon, and I'm going to demonstrate intramuscular injection. I'm going to start by verifying my physician's order, verify the 6 rights of med administration. I have the right patient, drug, dose, route, time, and documentation. I'm going to do my drug dosage calculation. So today the doctor has ordered 6 milligrams of morphine IM. It is supplied in 4 milligrams per 1 ml. So we'll withdraw 1.5 mLs to get our 6 milligrams per 1.5 ml. We'll gather our supplies, enter our patient's room, close the door, curtain for privacy, perform hand hygiene. Hi, sir, I'm Kim. I'm going to be your nurse today. Can you verify your full name and date of birth? Verify 2 patient identifiers. Okay, Mr. Smith, do you have any allergies to medications, food, environment? Fantastic. Today, your doctor has ordered a morphine injection. We use morphine to treat moderate to severe pain, and it just interrupts the pathway of pain response to your brain. Some of the side effects of this medication are going to be nausea, vomiting, constipation. Our more concerning side effects would be any dizziness, lightheadedness, low respiratory rate, low heart rate, low blood pressure. So let me know if you experience any of those. Also, some people complain of some burning or stinging with the administration of this, so just be aware. Do you have any questions? Okay, so we're going to do our hand hygiene and put on clean gloves. All right, and then first we're going to start by verifying we have the correct supplies. So I have a 3 ml syringe and a 22 gauge 1-inch needle. So we will attach those together. We're going to start by wiping the top of our medication vial with an alcohol prep. We'll withdraw 1.5 mLs of air and inject that into our vial. And withdraw our 1.5 milliliters, which is going to be our 6 milligrams. All right, we're going to tap for any air bubbles and ensure that we are at our 1.5 mLs. So here is our 1.5 ml dose. We are going to safely recap our syringe, our needle. If we have withdrawn this away from the patient, then we will label it with our medication and our dosage. We're going to select our appropriate site. So we'll have our patient lay supine or lateral. We're going to select our site. Today will be the ventrogluteal site. We'll put the heel of our hand on the greater trochanter. Make sure that our wrist is almost perpendicular to the femur. Point our thumb towards the patient's groin. Extend our fingers up along the iliac crest. Our site is going to be the V between our index finger and our middle fingers in that iliac crest. So we're going to make sure that our site, we're going to inspect our site for muscle size and integrity. We're going to make sure that there's no bruising, skin discoloration. We're going to palpate for any edema, tenderness, masses, and make sure that he hasn't had an injection in that site recently. We will cleanse our site with our alcohol prep, circular motion inside to outside, about 5 centimeters. We'll let that air dry without blowing or fanning it. Next, we are going to hold some traction using our the ulnar side of our non-dominant hand, and we'll pull some sideways traction for that Z-track method. We'll also hold the skin nice and taut while we administer. So we're going to hold that skin, hold our lateral traction, 90-degree angle in. We can release our skin tension, and we will use that to use those fingers to hold support on that needle. We will slowly inject our medication. For this one, we're going to aim for about 10 seconds per ml and inject that slowly. After we inject it, we are going to hold it for about 10 seconds before we withdraw our needle. and then we will release our traction and withdraw our needle. We're going to place our gauze, put a little bit of pressure, but make sure we're not rubbing that site. If our needle has a safety mechanism, we will initiate that safety mechanism, put our needles in the sharp container, bandage this if necessary. We will discard our supplies, remove our gloves, and perform our hand hygiene, and then document our procedure.